Fuad Elkhoury, Assistant Clinical Professor at the UCLA Department of Urology and specialist in surgery for men with urinary symptoms due to benign prostatic hyperplasia, also known as BPH. Over 80% of men will experience some difficulty urinating in their lifetime. Urinary frequency, urgency, slowed urinary stream, waking up several times at night to void, a sensation of incomplete emptying. These bothersome symptoms can really impair a man's quality of life every day. While many may just attribute this to getting older, our patients don't need to let these symptoms go unaddressed. We have several evidence-based therapies to improve our patients' quality of life, to turn back the hands of time on their urinary function. Our first objective is to determine if the patient is experiencing these symptoms due to an enlarged obstructive prostate or to an overactive bladder. This may require office-based procedures like cystoscopy and pressure flow studies under local anesthesia to better determine the cause of these symptoms. Once we have a diagnosis, we work together with the patient to tailor a treatment plan according to his preferences and goals. In cases of BPH, we have medications such as alpha receptor blockers like tamsulosin, silodosin, alfuzosin, and 5-alpha reductase inhibitors like finasteride and dutasteride that may alleviate these urinary symptoms. For men who prefer to avoid medication, have bothersome side effects from the medication, or do not benefit enough from medication, we have excellent surgical options that are definitive and have superb outcomes. Holmium laser enucleation of the prostate, known as HoLEP, is a cutting-edge, minimally invasive surgery that is tailored to each patient's unique prostate. It is a surgery that can treat any size prostate and is especially good for men with very large prostates, specifically over 80 grams. HoLEP is done entirely transurethral, meaning the surgery is done with a cystoscope and a laser through the urethra only. There are no skin incisions. During surgery, the surgeon peels the obstructing prostate adenoma away from the prostatic capsule using a laser and a cystoscope. When explaining this to patients, I use the analogy of peeling the pulp or meat of an orange from the orange peel, with the pulp being the obstructive prostate adenoma and the peel being the prostatic capsule. We follow the natural anatomic planes and remove almost 75% of the prostate tissue to result in a wide open channel that allows the urine to flow freely and with minimal resistance. HoLEP can take around 1 to 2 hours and is almost always an outpatient surgery, meaning the patient is discharged home the same day. A Foley catheter is left in place overnight, and the patient has the catheter removed in our office the next morning. Once the catheter is removed, most patients are blown away by how forceful their urinary stream is. They experience significant improvement in their urinary symptoms almost immediately, and patient satisfaction with HoLEP is very high. Due to these outstanding outcomes, HoLEP is now the most sought-after prostate surgery. A major advantage of HoLEP is that we have excellent long-term data showing how durable the outcomes are. When we follow men 20 years out after HoLEP, only 1.4% require another surgical procedure for their prostate. That is significantly less than any other prostate surgery. Another advantage is the time with a catheter after HoLEP is usually under 24 hours. A third advantage is that the blood loss during HoLEP is minimal. The laser we use is excellent at hemostasis, and patients often have clear yellow urine immediately after surgery. Patients can go home the same day of surgery due to the fact that their urine is nice and clear post-operatively. And finally, patients are surprised by how little discomfort they feel after HoLEP surgery. I routinely only prescribe Tylenol for men after surgery. There are 2 expectations to keep in mind with HoLEP. First, the patient should expect to have permanent retrograde ejaculation after HoLEP. This is due to the function of the prostate adenoma pushing semen forward during ejaculation. Importantly, erections and orgasms will be the same after HoLEP as they were before surgery. Second, approximately 30% of patients may experience temporary urinary leakage for a few weeks to a few months after HoLEP. Oftentimes, this is due to an underlying bladder overactivity that is now unmasked once the enlarged prostate is addressed. This may require a small pad or even a male diaper during the recovery period. In almost all cases, this leakage resolves in a few months. So for men experiencing urinary symptoms impacting their quality of life, or for men suffering from urinary retention requiring a catheter, HoLEP is now the new gold standard for treating these men and returning them to good health. It is truly a life-enhancing surgery that we are proud to provide here at the UCLA Department of Urology.